This next question, which is becoming increasingly common. She writes, "Dear doctors, I'm expecting my third child. I'm hearing more now about storing umbilical cord blood than I did with my first two babies. How does it work, and is it necessary?"
This is a great question, and basically what I tell all my patients is it's not going to hurt the baby and has potential right now, so many different life-saving potentials, and stem cell research is just exploding right now. So when your child, if your child was born today and, was like 10 or whatever, and you stored it, you may be able to heal cardiac disease, diabetes, certain neurologic disorders. It used to be thought that it was only used for certain rare blood disorders, but now it can have so many other potentials. And basically, if you take a look, a lot of people don't know what umbilical cord blood is, but basically the fetus who's in utero, there's an umbilical cord, and that gets the nutrients from their mother supplied by the placenta. The placenta acts as a filter and as an organ, doing hormones and other things. But the blood that goes in the umbilical cord with all those nutrients, there are what we call pluripotential cells. And just think that the baby is, making skin, making organs, and all kinds of cells. So it has the framework in these cells to do all these different things. A lot of times we used to just throw away the placenta, and the cord blood would go with the extra cord that we took. Now what we do as obstetricians is after we've delivered the baby, basically we just inject, this is a needle, and we basically stick this into the umbilical cord. It is so easy, and it literally takes like a minute. We sterilize the cord first, put this into the cord. It's essentially a needle like a blood draw, and the blood goes into a bag, just like a blood bag, and then they make it so easy as far as collection and culling and everything. And this takes a second, and these cells can get stored. And again, the potential down the line, now the problem is it costs money. So it is a question for parents whether or not they can afford it and do it. But I say if you can afford it, do it.
Yeah, I tell parents that it's kind of like a health insurance policy. It's really great to have. You kind of hope you never need to use it.
Right.
Because over 100,000 people every year are treated for a disease that could be cured with cord blood stem cells. So, the need is out there, and it's one of those things. If you need it, if your child gets sick or a sibling gets sick, having the cord blood there is such a lifesaver. But, like you said, it's not cheap. It's about $1,000 to $2,000 to collect it and freeze it. And then after that, about a little over $100 every year for the storage fees. So it is an investment, but if you think about what else you spend on your family to keep them safe, car insurance, other things, it's really not that expensive. And there are programs for families that are really in need of it. Suppose you have a child that is already sick and you have to store the cord blood, you can get it handled. The companies will kind of help you with financially.
What is it used for, to treat?
It's used to treat leukemia, lymphomas, certain immune disorders, other blood problems like anemias, thalassemias. So,
but also now we're seeing that also in diabetes and in cardiac disorders, they're seeing a lot of potential.
I think the future potential for stem cells is amazing. I think it's not too long from now we're going to be able to grow brand new organs out of stem cells. So I highly encourage all my parents to, if you can, store the stem cells.
And it's just frozen like the other things we talked about. And then if you ever need it, just...
Storing the stem cells aren't going to just help that baby, but sometimes you can help the siblings, because maybe a baby might be born with certain immune problems where the baby's own stem cells are the problem. Then you get the transplant from one of your siblings, so that's why it's important to try to save it for each of your babies.
And you also want to check out the company. Make sure that it's a reputable company, because all the checkpoints of how they, from the time they collect it to how they store it, how it's handled, are extremely important.